Hi, my name's James Kilzer. I'm a student at Regis College, and this is my capstone or proposed capstone on building quality and indoor air quality across Boston Public Schools. This is analysis of school-level CO2 concentrations across building quality indicators, and this marks implication for future student respiratory health advocacy and change. Introduction: why this matters. Respiratory illness trends are among the most common health condition for children, and asthma and lower respiratory infections are the most common reason for absenteeism in schools. And this is something I can personally speak to, as I grew up with asthma and still have it, and I definitely experienced this. After COVID-19, there was a new need for respiratory health protection and being able to control this. And this is now at an all-time high, as protection is now being monitored and technologically advanced using sensors and HEPA filters. Now, why are children most at risk? Children have underdeveloped respiratory and immune systems. Urban exposure throughout various peer-reviewed sources is linked to respiratory morbidity, along with emergency room visits and hospitalizations for not only schools, but also adults. But considering underdeveloped respiratory and immune systems, it's incredibly pressing and a serious risk for children. School environments, they equal a platform for prevention or spread, as air will continue to circulate in indoor settings, whereas in outdoor settings, they can touch, but you're still in an open environment. Problem statement and research gaps. What is the current challenge? As you can imagine, what I'm about to state, children within Boston Public Schools, but across the country, they go to school in buildings with varying ages and infrastructural quality. Monitoring of sensors reveals substantial differences within ventilation performance and CO2 concentrations. And along with that, building quality as well. Literature shows short-term interventions and COVID-19 outcomes, not long-term remediation. And along with this, there's not school-based respiratory illness reporting, which would be greatly beneficial for future advocacy and policy change. There's limited research for aging HVAC systems on respiratory health, so this is a study that addresses that. Additional research would be required to, one, understand this relationship, and two, guide intervention. And that relationship is, what is the relationship between building quality indicators and ventilation success, or CO2 concentration and ppm readings? Purpose and objectives of this study. Purpose of the study is to examine the relationship between building infrastructure quality score and CO2 concentrations across BPS in the whole system of 125 schools. Objectives: investigate both environmental quality indicators and building quality indicators across BPS. Investigate the relationship between building quality indicators and filtration efficiencies. Provide evidence that informs future policy decisions and infrastructural improvement for buildings and technology. Excuse me. And that third objective, I think that's really two-part, and that's really to do two things. Indicate locations that require infrastructural remediation, which I can show you in a top 20 CO2 concentration chart that I provide later in this report, along with indicating peak hours when infiltration of CO2 hits all-time highs, and provides evidence for, and overall providing evidence for new standards within indoor air quality measurement and respiratory disease reporting for students. Now, overviewing the literature available, as stated, after COVID-19, there's an increased need for mitigation of airborne disease transmission in correspondence with new technology and knowledge of how transmission takes place. And as a result, there were 3,600 sensors that were installed over 125 locations across BPS. This doesn't really graze the surface of the rest of the sensors. The rest of the filters that were installed across the city in indoor locations. HEPA filters improve air quality indoors and reduce exposure, not only for students, but like I stated, these are across the city as well. So this is great for overall population health. Older buildings, they use HVAC systems, which lead to lower ventilation, and there's limited literature for ventilation type by building within BPS, meaning this building has HVAC, this one has central, rather than just raw summaries that state how many schools have certain types or certain system types. Now, moving forward, there's infrastructural discrepancies that may contribute to ventilation discrepancies and differences in student health. HEPA filters, they are proven to show improved ventilation and are associated with lower disease transmission. And this is fantastic, as with after COVID-19, this implementation will not only mitigate this, but I think the efficiency and effectiveness will also point to further installations at more locations. Only 8% of days exceeded 1,000 ppm in centrally ventilated schools, which is compared to 35% of days with no mechanical ventilation at all. So as like a baseline, we can look at no mechanical ventilation, which averaged 945 ppm for CO2, and central ventilation averaged 698 ppm CO2 across Boston public schools, while supplemental ventilation averaged 916 CO2. So just looking at some numbers, looking at it raw, just as some numbers, you can see that discrepancy alone. Now, evaluating studies and data sets available. School-level environmental studies from BPS provide detailed indoor air quality measurements. Publicly available information on building quality was evaluated, as you can imagine. Data from public health organizations provide population disease trends for COVID-19, however, not for school. And as I was stating, for future renditions of this capstone, taking a closer look at respiratory disease outcomes within schools would be greatly beneficial in not only pointing to advocacy, but also policy change in the future for BPS. Studies, they use descriptive statistics, trend analysis, prevalence, and regression analyses. Now, what is helpful for a study like this? Differences across studies provide platforms for cross-study comparisons, and utilization of multiple data sets could strengthen understanding of these relationships, not only HVAC's implication on indoor air quality, but also CO2 readings based off of these systems. Methodology. Now, we are going to be using this proposed capstone would be using a quantitative retrospective study approach, ecological observation design. Would look at the school/building level, and these secondary data sets that would be providing this design would be collected from the Boston Public Schools Indoor Air Quality Dashboard, BPS Facilities Assessment, and peer-reviewed surveillance reporting, like from GE ETAL 25, which evaluated the BPS dashboard itself by cleaning the data. The primary variables that were used within this study or valued within the study are mean and max CO2, overall building score, facilities condition score, energy and space efficiency and energy efficiency scores as well. And additional considerations for this analysis is that association was evaluated and not causation. Units that were used or evaluated within the study were individual schools within BPS. Taking a short service level look at data analysis, at some of the data analysis for descriptive statistics, there were 125 schools collected for CO2 reporting. However, within BPS, there's only 119 that matched for quality reporting or quality score reporting, which I think is frankly unacceptable. For if it's going to be monitored every minute for CO2, why can't there be readings for all 125 schools? Mean school CO2 was 507, median school was 475.73, standard deviation of just over 94 ppm, the range of 371 to 861 ppm for school hours. This included minimum and maximum CO2. This study and its analysis will also be including minimum/maximum CO2 readings, number of sensor readings, and percentage of days over 1,000 and 2,000 ppm for CO2. Some of the methods that will be used, such as in statistical tests or statistical analysis, would be one-way ANOVA, simple linear regression, and Pearson correlation. Statistical significance was evaluated at beta 0.05 or alpha 0.05. Whoops. Now, looking at some of the results that came from our peer-reviewed sources, along with the relationship that I personally evaluated from these data sets between CO2 concentration and building quality indicators. Here is the summary. So to give you some context, 74 out of 124 buildings were built before 1940. 36 buildings are more than 100 years old, and 96 schools lack ventilation systems that provide fresh air. Ventilation type, by ventilation type, central, supplemental, and none all vary drastically with supplemental and none drawing the closest comparison, as we kind of went over those readings in the slide prior. Percentage of days for CO2 over 1,000 ppm for none, 35. This is pretty dang close to supplemental, which was at 31%. Supplemental being HVAC and other methods that do not use modern filters, and central, which was at 8% for the number of days over 1,000 ppm. These findings that I state in these first two tables are from GE ETAL 2025, which was an evaluation of the BPS IAQ dashboard that is available publicly online. And this data was filtered, cleaned, and it was taken for not all readings, but for school days. Now, some of the statistical analysis that I conducted had these findings. For the one-way ANOVA, mean CO2 differed significantly across BPS schools, which is pretty fair. Pearson correlation, higher building scores were weakly associated with lower mean CO2, which I think indicates that there are numerous confounding variables, which is what we're going to get into. Linear regression, building score explained 3.3% of CO2 variation. And with each 1 point increase in building score, predicted a 1.21 ppm decrease. So as building quality went up, CO2 concentration decreased ever so slightly. There's some visualizations just to give you an idea for advocacy and being able to identify schools that are in dire need. Here's the top 20 schools based off of mean CO2 concentrations. And for the regression visual, you can see that for mean CO2 is positively correlated with maximum CO2 by school. This data was taken from the Boston Public Schools Indoor Air Quality Dashboard. And this data is not cleaned, includes all readings, and is across all hours. Discussion. Central ventilation is equals substantially lower CO2 than supplemental or ventilation or no ventilation. Varying CO2 readings indicate indoor air quality IAQ is not uniform across BPS. Higher building quality showed association to lower mean CO2, and only 3.3% of variation within mean CO2 was explained by building quality. And so some of those potential confounding factors, I'm going to go into some more, but to start, occupancy, room size, age of system, and other factors should definitely be controlled in future renditions of this study. Statistical analysis was consistent with prior research, indicating that not only was my analysis following what has been published, but also what is already out there. However, reinforcing the fact that there is a relationship between indoor air quality and building quality throughout BPS. Overall, environmental monitoring is key to future change and improvement within infrastructures and systems. However, additional research and data sets on respiratory illness trends at the school level would be greatly beneficial in exploring additional causations applicable to this first relationship. Conclusion. Some takeaways. Indoor air quality variation was throughout BPS. Central ventilation is inherently superior in filtration capability. Building quality showed a weak relationship with mean CO2, and there were operational and environmental factors that were affecting that, which are well related to our confounding variables that need to be controlled in the future. Continuous monitoring is imperative for the future, as it provides not only transparency, but also clear look for the public eye at what type of risk our children are at. Reporting of school airborne illnesses is essential for the future. As I stated, being able to apply this relationship to another one would be fantastic. Another factor such as respiratory illness trends. Limitations. The data sets, they come from secondary sources. This is a retrospective design. As I stated, school level respiratory data is not available. And there are uncontrolled variables such as occupancy, room size, season of the year, and HVAC system age by school. And causation is not established. Recommendations. I think that we need to expand central ventilation across BPS. Further regulations on on ventilation requirements for after hours need to be reevaluated and further reinforced. Massachusetts Department of Public Health collection of longitudinal research needs to be conducted for our schools, and there should be a longitudinal evaluation of indoor air quality, building conditions, absenteeism, and airborne disease trends across BPS. Thank you. These are my references.